Hello, everyone. I trust that every one of you is doing good and that your day has started well and that you will, experience so many great things today. Anyway, today I'm here to talk to you about what you should know about dental pain and antibiotics. There are so many people who in their mind they do believe that if they have dental pain and they go see a dentist, then the dentist ought to prescribe antibiotics to them. So it's true that people perish or people experience difficulty or unnecessary levels of pain because they lack knowledge. So today I just want to drop a little bit of knowledge as far as what you have to know about dental pain and antibiotics. So as I was saying, many people know or they have it in their mind that if they have dental pain, they experience some pain because they have infection. Yes, or maybe they just have, a tooth that's broken or something that's hurting in their mouth. Then when they go to the dentist, they would be prescribed some antibiotics. However, I'm here to let you know that it's not always the case. So the reason why a dentist would actually prescribe some antibiotics would for sure be if like we see that you have an obvious infection. Then yes, we will prescribe antibiotics. Say we see pus or things of that sort, then yes, we will prescribe some antibiotics. But there are some other reasons for which really it will be at the discretion of your dentist. There are many cases where someone may experience dental pain and antibiotic is not necessarily indicated. So if you go to the dentist and lo and behold, they don't prescribe antibiotics, don't just think that they don't know what they're doing, or maybe, that particular dentist is not, a good dentist, not knowledgeable because they did not prescribe antibiotics. So from the get-go, it will be at the discretion of your dentist, and please trust your dentist when they do or when they do prescribe antibiotics or when they don't prescribe antibiotics. Just trust the process. So that's number one. I want you to get out of your head this idea that if you have dental pain, then yes, dental antibiotics has to be prescribed to you. I just want to ponder upon that because we see so many patients that come and they have that expectation after we have done the exam, and they're like, oh, am I going to get antibiotics? I may or may not prescribe antibiotics, and it's okay. So yes, so that's to begin with. So the as I said earlier, if we see an obvious sign of infection, we will prescribe antibiotics. So one thing to consider is this, or something that you have to absolutely let the dentist know about antibiotics, is that you have some people who might be allergic to some type of antibiotics. For example, we see many people who are allergic to maybe like penicillin or like all the cillins. In that case, it's very, very important for you to let the doctor know that, so that they may prescribe, so that they will prescribe, if they need to, the appropriate antibiotics that you do need to take. So, about allergy, though, some people are just sensitive, or maybe, because when you do take antibiotics, you want to make sure that you eat something, you have something in your stomach. We not necessarily say that you have to have a full-blown meal, but you definitely have something in your stomach when you do take. So take it with some type of food, a piece of something, to eat, so that it can help you. Otherwise, you'll feel kind of sick, and you might think that you're allergic to the medication, but it might not necessarily be so. So about signs that you're allergic to antibiotics, I'm going to just name a few. You might experience some redness or some swelling, or you difficulty maybe breathing, or you break out in hives or itching, those are signs that you are allergic to antibiotics, and that you should definitely let the doctor know that this is what you experience when you take antibiotics. In some cases, too, antibiotics will be given to you as a prophylactic. So there are some conditions that have been stated by the American Heart Association, whereby someone who has those conditions would have to be prescribed antibiotics before any dental treatment, sometimes including even a cleaning. So if you come with some conditions and the doctor say, I cannot treat you today because of this and this and that condition, don't feel like you're being mismanaged or neglected. It is for your own safety. So the American Heart Association over the years has lightened things up a whole lot. I remember when a few decades ago, I went for my yearly checkup to see a physician, and when they listened to my heart, they heard that I had a heart murmur. And thank God, over the years, it hasn't been heard anymore. But I remember at that point, the physician telling me, so when you go to the dentist, if you go to the dentist, let them know that they need to give you medication prior to your treatment if you need treatment because of this heart murmur. But it's been a couple years now that a heart murmur is no longer an indication that you need prophylactic antibiotic. And prophylactic antibiotic just means that you're going to be taking these antibiotics before 1 hour before treatment. So that's also another reason why it's very important for us to obtain a very good medical history, dental history, so we know how to treat you appropriately. So some people don't always share, all the information as far as their medical history or, past surgery. They feel like, oh, I'm just at the dentist. Why is it necessary? Yes, it's very necessary so that we can keep you safe, that we can treat you accordingly. So even though we're talking about antibiotics, if you know that you're taking some medication and you know that you don't really remember what they are, please write them down on a list and provide us with a list of medication that you're taking, and also all the allergies that you do have, so that we know how to treat you accordingly. So why is it that the dentists don't always prescribe antibiotics? What are the dangers? Like, is there like any dangers as far as being prescribed antibiotics left and right for any reasons? Yes. It's not good, for someone to take antibiotics for reasons that are not, necessary reasons. Why? Because bacteria are very, very smart. And so, the more you prescribe antibiotics all the time, bacteria start to becoming resistant. So they will develop, mechanisms to make themselves stronger, if you say, so that, they are no longer affected by these antibiotics. So that's one of the reasons why we don't want to prescribe antibiotics all the time, especially when it's not, necessary, because you may end up, finding yourself in a situation where you are taking antibiotics and now you have a super infection, or, the bacteria have developed resistance towards the antibiotics, and it is no longer working. So with that being said, it's important for people to take, if they are prescribed or when they are prescribed antibiotics, it's very important for the patient to take these antibiotics accordingly. Too many times we see these patients who come and you ask them what medication they are in pain. We ask them, what medication have you been taking? And they would mention that they've been taking antibiotics. And it's like, okay, so was it prescribed to you? No, it wasn't prescribed to me. My mom had some leftover antibiotics, so I started taking them. And it's like, wait a minute, like, first of all, why did your mom not finish her dosage, or the whole antibiotic dosage that was given to her? Why did she not finish it? Because once you start taking antibiotics, we always stress, your physician, your dentist will always let you know, make sure, please make sure that you finish it and you take it accordingly. When you find yourself in situation where you are skipping a dose, it's not like a time. Say for example, you were supposed to take it in the morning and you forgot, you went to work, sorry, and you forgot to take it. It's very important for you to make sure that you're taking it. If it says 3 times a day, please take it 3 times a day. If you're supposed to take it 4 times a day, please make sure you take it 4 times a day. If it says, take it twice a day, please do take it twice a day. Try not to skip doses, because that can lead to resistance, of bacteria, or bacteria becoming resistant to the antibiotics. So take it accordingly. And please don't go and say, oh, my brother had, some, so I just started taking it. And then another things that people do is like, yeah, so they would start, taking it, and they take it accordingly. But like once they see that, or what they don't say, feel that the pain has been released, then all of a sudden they stop taking the antibiotics. Friend, please don't do that, okay? If it was given to you for 7 days, take it for 7 days. If you were supposed to take it for 10 days, take it for the 10 days complete. Take it all the way to the last pill. Why? Because you don't want a bacteria to become resistant, and next time you're taking it, all of a sudden this antibiotic is not doing you any good. It's of no service to you. So yes, don't be the one to go and fetch out, or like, oh yeah, I had antibiotics, like, that was prescribed to so and so, so I'm taking it because there was some leftover, or I got it from Mexico, or I got it from Congo. I'm from Congo, so many people say, I have this stash of antibiotics, and anytime I feel something, I just take 1 or 2. Please don't do that. That's not going to be helpful to you. So yeah, so again, just to recap, I think I've said the gist of what I wanted to say, but just to recap, antibiotics is not always necessary, but when prescribed, please, 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 I am beseeching you, please, again, try to take it, do everything to take it as prescribed. Go ahead and take it at the times prescribed. Take it all the way through, finish everything. Try not to skip a dose. And if for some reason you happen to skip a dose, please continue. Don't like, oh, well, so now it's not. No, just go ahead and continue taking it. Try to not skip a dose for the next time. So that way, you can find the release the relief that you do need. And the last thing I wanted to say, sometimes when people come, they have they experience severe dental pain, and lo and behold, I or another dentist would prescribe antibiotics to you. Sometimes, we would say, okay, we need to wait a couple of days before we can come and do the treatment. Oftentimes, it takes about 3 days for the antibiotics to start kicking in and to where we can actually do the treatment. So one thing that happens sometimes when somebody has such severe infection is that, let's say, for example, somebody needs to have perhaps a root canal, or maybe like a tooth taken out. Well, if the infection is so big, then, we might want to anesthetize you so that you can be comfortable, or numb you, right? So that you can be comfortable for the treatment. And then once we put the anesthetic, the infection actually neutralizes the effect of the anesthesia. So if we treat you right away, then you'll be in so much unnecessary pain. So when your dentist tells you, okay, so I'm going to prescribe antibiotics and I need you to come after 3 days, understand that it's for your own benefit, and it's not that the dentist is being lazy or does not want to take care of you right away. And the last thing, I know I said the last thing, but what I wanted to also say that's very very important is that some people, there are many people who come because of their anxiety or maybe because of their work schedule. They come to the office, they have dental pain, they come to the office and we prescribe antibiotics. So then, once they find relief, and they may even have an appointment, to come and have the treatment done accordingly, like maybe like 3 days after or a couple of days after, and then they feel relief, so they're like, oh, I feel good now, so I don't have to go, especially, I'm so scared, blah blah blah. So they don't come, right? And then a couple weeks ago, a couple months ago, there goes the pain again. Friend, I want to let you know that, if we actually have prescribed things to you, yes, you may feel the pain, but it will be a time where that infection will flare up, it will come back, and you'll find yourself in a dental chair again, talking about the same thing. I'm in pain, I can't eat, I couldn't sleep last night. So if you have, been prescribed antibiotics, don't be fooled by the fact that the pain has decreased. If you don't actually take care of that particular tooth accordingly, you will be back. And I don't want to be like trying to, be a giver of bad information or um, bad luck, if you say, but these are things that happen. So infections, if a tooth is infected, the infection might be taken decreased, for a period of time. If you don't actually take care of that tooth, it will come back. So please don't neglect that fact. It's very very important. Well, I've said a lot today, and if you have found this information valuable, please don't forget to share it. Don't not share it to your friends, to your family, co-workers who would benefit from the same information. The same way that you have been enlightened, somebody else in your world would find it very pertinent and important, and will be also willing to share it as well. So we are Healing Wings Dental. I am Dr. Valerie Mukanga. We are based and located in Arlington at 4101 West Green Oaks Boulevard, suite number 317. Our zip code is 76016, and our phone number is 972-213-0202. We would absolutely love to help you with your dental need if you don't have a local dentist that you already see. And if you're not in the area, please don't postpone trying to find dental care. It's very important. So that's what I wanted to share with you. Have a fantastic day and be blessed. Bye bye.